Good afternoon, Team Whiteman. Welcome to our virtual town hall today. You notice that I have a mask sitting right here. We are socially distanced 6 feet apart, and we want to be able to communicate with you today. Probably the big topic, and I know we're getting a lot of questions today about it, is the mask policy that I put out yesterday that goes into effect tomorrow, and I'm happy to answer those questions. Let's start off though with just some basic information, and I'll go over a couple other policy questions that we have been getting lots of questions about this week. First and foremost, hey, COVID's back. We've talked about this through various town halls over the last several months, and we also talked about being mentally prepared for when it does come back. We really didn't get much of a lull before it came back after the reopening. So 50,000 cases in the United States yesterday. It's rising in Missouri, rising in the surrounding areas, and we do have cases within our base population. So with that in mind, there is a reason for why that mask policy is coming out. Wherever you stand on the science behind the use of masks, it's pretty clear now that we have learned over time that if two people have masks on, the chance of transmission of COVID, especially if we can maintain social distancing, goes down dramatically. So while it's not perfect and every mask is going to be a little bit different, it's a whole lot better than not having any mask at all. And that's why we're going to be having that policy on base. I want to address leave policy right up front. So leave policy is really simple now. I'm still getting some questions on Facebook about whether people can go on leave and where they can go on leave. So let me just lay it out plain and clear. The Secretary of Defense, in the last policy letter that was put out, essentially exempts leave outside the local area and in the local area from the original COVID policies, which means you can go on leave. You can go on leave anywhere you want now, effectively. So here at Whiteman, the way we are going to operate is we have some additional guidance from General Ray, our commander at Global Strike Command. There is a sheet that will be filled out. It has you do a quick risk assessment based on the number of cases in the state and the number of cases in the locality of where you're going to. You're required to get essentially a pre-departure briefing from an E7 or above, and then once that's complete, you put your leave into LeaveWeb and do that normally. So what I will tell people is that risk assessment's important. So that tool is going to show you low, medium, or high risk. If you're going to a high-risk area, it doesn't mean you can't go, but at that point, you're going to be working with public health, and that's the way the guidance is put out right now, is that if you are assessed as high risk, you and your supervisor are going to need to work with public health to make some determinations about if you're going to need to do anything additional when you return. The number one most important thing, you'll see this in bold letters on the sheet, is when you come home from leave, wherever you went in the United States, if you are sick, do not come to work. Period. Dot. So we are finding that is the one commonality in all things with COVID cases. If somebody comes to work, other people end up sick. So I need people to take that seriously. You've done a tremendous job with that so far. We don't have a lot of cases from people coming to work sick, but the few that have happened, they end up getting multiple people sick. So please take that seriously. So get out there, get your leave in. I realize everybody can't go on leave at once, and we do have some major muscle movements that are coming up in the month of July and towards the end of July. But my intent and what I've given through the group commanders to the squadron commanders is to let your folks go on leave. So I realize this has been a stressful time for everybody, and we want to get out, we want to visit family, we want to get some recreation that's outside of the local area. So that's the policy right now. If you have more questions, I'll do my best to answer the specific situations. Visitors on base. So we get the visitors on base question all the time. So my intent right now, and I will put out the policy formally a little bit later, is that we will reopen the base visitor center to allow passes on the 7th of July. So after this holiday weekend, the down day on the 6th, the 7th of July, I will have the visitor center open again to start issuing passes. So be patient. I'm anticipating there's probably going to be a flood of people. We're going to do our best to keep the manning up there so that we can process people quickly. Once again, though, just like leave, where we make assessments about the risk of our travel, I need you to have honest conversations with particularly family that are coming in from other parts of the country. So if they're coming from areas where COVID is a real problem, you need to think about the precautions that you're going to take with your family to make sure that you stay safe and that you're available for the mission. Part of the reason I'm opening the base up for visitors at this point is because of the mask policy that we put in place. So essentially, your visitors, if they're in any facilities on base, are now going to have masks on as well based on that policy. So we feel from a public health standpoint that that's a manageable trade-off, and I know it's something that people really look forward to getting back. As far as recreation stuff goes, so we got the fireworks tonight. A lot of discussion back and forth over the last couple of weeks about whether or not we wanted to go forward with that. Part of the reason we delayed on the visitors policy is because we knew that we would have a lot of people want to bring visitors on base for that. So you're not going to be able to get a pass to bring visitors on base for the fireworks tonight, but DoD card holders can come on and enjoy the fireworks. There's not going to be any food, there's no bouncy castles, the playground's going to be ripped off up there just because there's no way to control that many kids at one time, and there's going to be circles painted on the ground. So some of you may have seen that online. There's been a couple cities that have done that. We're going to try that out tonight. So I would ask for everyone to take personal responsibility when they show up tonight and keep yourself spread out. I'm not mandating mask wear at the outdoor event tonight, but it's highly encouraged. So bring your mask, and that way if you find yourself in a situation where you're going to be in a big group of people, you can put your mask on. I'll be down there tonight. I'll have my mask with me, and you probably see me wearing it around if I'm going from group to group talking to folks. So it goes back to personal responsibility in keeping yourself safe and keeping your teammates safe. All right, with that, Chief, do you have anything you'd like to add?
Just a couple of things. So I know the boss talked a lot about leave, but also keep in mind that there's still policies when it comes to taking passes. So if you're going to be in the local area, not on leave, and you're going to go further than an hour from where you live, there's still some paperwork that needs to be accomplished. Your first sergeants, your commanders, your superintendents, they all know about that paperwork. So just make sure you're getting that filled out. That way we're keeping a good track on where you're at and what you're doing. And then obviously with leave, you're going to have the public health review. A lot of stuff going on. It is busy as ever, but we're just doing our best to continue to keep you and your families as safe as possible.
Yeah, that paperwork that you fill out for a pass if you're going outside of an hour, it's the same piece of paperwork that you use for leave. It was dictated by General Ray. It's a risk assessment form and a pre-departure brief that happens if you're going outside of an hour. If you're inside of an hour, you're good. You don't have to, if you're just on a pass, that's just like normal pre-COVID life. You just go do your thing. So, okay, well, let's see if we have any questions coming in. I'm sure there will be some, and we will do our best to answer them.
One question right now is actually, when will the pool be open for families? I mean, not just labs.
So, I had a plan on my desk to start looking at families towards the end of July. That was before this latest upsurge in COVID in and around the surrounding area. So I'm going to continue to look at that. I don't think it'll be before the end of July, though. So, and just hold on tight. We're going to try. It's open for lap swim right now from 10 to 5 at night. But it's going to be a little while before we want to put a bunch of kiddos in the pool together. I realize it's outside, but after talking with folks and having had 3 small children myself at one point, I realized that if you get 20 kids up there, you're going to have 20 kids that are all close together in the pool. So we're going to hold tight on that from a public health standpoint.
And then I've been questioned on when will visitors be allowed on basis that may be consistent with the previous answer.
Okay, so 7 July. Visitors, you can come and get your passes on 7 July for visitors. And I'll put that out through a wing-wide email today, just to reiterate to everybody.
And then for the new mask policy, how is that going to be enforced? That's another question.
So the primary way that we enforce masks is we take personal responsibility. So I'm asking you, as the broad audience, as the wing, as teammates, and as partners of Whiteman Air Force Base, to do the right thing and wear a mask. So what I'm asking supervisors to do, and particularly in the work centers, that is commander's business and supervisor's business, and they are tasked with ensuring that they are complying with the DoD guidance inside the work centers. And I particularly broke out public facilities on base from the work centers, because I want commanders to be commanders and take care of the business within their work areas. As far as all the public areas on base, you can anticipate it'll be a lot like the commissary right now. So right now, if you come into the commissary, if you don't have a mask, they're not going to let you in. So now the commissary happens to provide masks for people that show up without them. That will be up to individual locations. The expectation that is just like it is in Johnson County now. So there's really no reason why we wouldn't be having masks, because you can't go anywhere downtown without a mask now. So bring your mask, wear your mask, and if you don't have a mask on, you can expect somebody's going to probably say something. But we need to work together as a team to do that. So I'm not going to hold a club over everybody's head and say that you're going to get punished or shamed because you don't have a mask on. But I do need you to wear a mask. So please, it's a personal appeal, do it. Do the right thing.
And I would say there's kind of two aspects of this. So if you're a military member, there's good order and discipline, and you will be enforced. If you're not a military member, being on the base is a privilege, not a right. And so that's where we will appeal to you that this is your responsibility, by the fact that you have the privilege to be on the base, that you will wear a mask to keep yourself safe, and to keep me safe, and to keep the boss safe, and to keep our kids safe. That's all we're asking.
So we do get a lot of questions about kids wearing masks. So we follow the CDC guidance, which recommends 2 years old and up. You don't put masks on kids younger than 2 because the assessment from a medical standpoint is it becomes a choking hazard for them, and the chance that a 2-year-old is going to be able to keep that on. Now, once again, I've had 3 kids, so I know how 3, 4, 5-year-olds can be. One of my kids is autistic. I know how a 20-year-old can be when it comes to trying to keep a mask on and wear it properly. So, kind of reference what I talked about earlier. This is where we're taking care of each other, and we have personal responsibility. I realize that day one, if your 3-year-old's never worn a mask, the chances that you're going to be able to throw a mask on them and it's going to go great is probably slim to none. But start working on it. And I don't know where we're going to be at 2 months from now. I do know that the policies downtown are now enforced, and I do know that we're safer if we wear those masks. So work on it. I think everybody understands if you've got a cranky 3-year-old that's pulling the mask off, nobody's going to come after you for that. But continue to work on it with them, and that's the goal. And maybe after a week or 2, they get comfortable with it, and we carry on. So I get it. Every circumstance is a little bit different.
All right. Next question was actually about the gym. When will showers and locker rooms be open?
No time soon. So from a public health standpoint, I'm comfortable with the way we're operating in there right now. We went back and forth a lot on the mask policy about how we were going to operate in the gym. So bottom line, I know it may look funny, and I know I've gotten some questions about, hey, why can I take my mask off for cardio but not the weight room or when I'm walking around in there? We had the medical community here at Whiteman, really took a long look at the cardio aspect of that. And bottom line, there's risk either way. So if with the mask off, there's potentially a COVID risk, which we hope is very small because our numbers are very small. But with a mask on, there is some level of quantifiable risk when you're doing heavy cardio to being, rebreathing in terms of CO2. Now, walking around, shopping, doing normal stuff, that's not a risk. But when you're on a treadmill or you're on an elliptical and you're going hard, having that mask on can be an impediment for some people, not all. So the assessment, we had to go one way or the other, and that's why I went the way I went. But everything else from the gym standpoint, it's an inconvenience, but I consider it a pretty minor inconvenience in terms of locker rooms and the showers right now. Okay?
And next questions were about the CDC. When will be more spots open, or will it be fully open at all?
CDC's tough, folks. I mean, so we have pulled that open about as far as I think we can safely open it right now. So it's at about half capacity. The next jump essentially is a decision. The next decision point for me is to just reopen it fully, because there's really no more incremental steps we can take that won't cause us to have to decrease the amount of distancing and in the way we rotate kids in and out of there right now. So I'm not ready to go there yet. I think we're not, if things had stayed the way it was 2-3 weeks ago, then I probably would be looking at making that decision right now. But with the upsurge all around us in the local counties as well, I want to take as many precautions as I can with our kiddos to make sure that they're safe and that they're in an environment that we can keep track of this. And I also am not interested in trying to put kids in masks for 8 hours at a time, which I referenced the previous discussion. Imagine a classroom full of 4-year-olds trying to wear masks. That's almost impossible. So we got to keep the numbers manageable, and that's where we're at. I've reemphasized over and over again with commanders that the fact that you have a dual male couple or a single mom or a single dad that's struggling with childcare, that's not their fault right now. I get it. It's COVID and it's the medical reality of not being able to open that. And I've asked commanders to be accommodating and to find ways to work with people's schedules. So it's going to be a little while.
All right, and one question, if we have the answer to this, is do we know if schools will have to have masks, specifically the school on base, if we're there yet?
So I am in contact with non-Nostra School District on a regular basis, and I think they will, based on the conversations I've had, I would anticipate they're going to follow suit with mask wear. We'll see where the state of Missouri goes. I think right now, non-Nostra plans to open back up. I'm not going to speak to whatever policies they're going to have in place, but from talking with them, they're going to mirror our mask wear policy. My hope is that by the time school rolls around, end of August, that hopefully we're not wearing masks anymore. So, but we're going to have to be, I think this is going to be the reality from now going forward, at least for the next 6 months to a year, where we're going to have some times where we're going to have to tighten down like we are right now, and then when it's not bad, we'll try to loosen up and give everybody a break. So what I don't want to do is go back to just shutting everything and being locked back in our homes. I'm doing everything I can to make sure that we don't have to do that. So when I talk about personal responsibility when it comes to masks and making that choice to keep each other safe, realize part of that decision and the reason we are able to keep some things open is because we're going to do that instead. So there's trade-offs here. If mask wear is not good, then I'm going to have to find other ways, and we've all walked down that path before, to keep our population safe here on base. So I'm hopeful that doesn't happen. Okay?
Next question, are we still considered a green base when it comes to travel? I know you touched on.
Yes. So for the overall base population, for all our dependents out there, and our members that are watching today, the whole green, red, when it comes to leave, none of that matters anymore. So based on the DoD exemption that was put out. So don't worry about green or red when it comes to leave or passes. Doesn't apply. The only thing that matters that's green or red from an installation standpoint is PCS travel and TDY travel. So we are a green base. I don't anticipate us not being a green base in the near future. We have a lot of discussions at our level and with our senior leaders here on base about what the trigger points would be. If we go back to an HB-Con Charlie because we feel like we don't have a handle on tracing or community spread, that could drive us back to red. But I'm going to be reluctant to do that unless I really feel like the mission's being impacted. Right now, there is impact because we have a fair number of people that are in restriction of movement right now. But it's manageable, and we're able to still get the mission done. You're still seeing airplanes fly. We're still getting people trained, and we're ready to do the mission. So that's my big metric on that, and we'll see what we get going forward. Okay.
And just generally, where can guidance be found in regards to this new exemptions in the mask policy?
So it's all on the Facebook page, and there's a link in there. Particularly, I think there's a drop down that specifically says face coverings. So that'll give you the guidance. I sent out a wing-wide email yesterday on that as well, so that'll be in everybody's inbox, at least for our military members to see. And then we posted up, I think if you look at the Facebook message that we posted up yesterday, it had that list in there as well. So.
One other question, is it a possibility that it's on the table for considering closing or limiting visitors to certain facilities due to the rising cases?
So I want to make sure I have a question. So for closing or limiting visitors to certain facilities?
Correct.
So remains to be seen. No, not right now, because I don't know what our visitor load is going to look like. So here's the world we're living in now, folks. I mean, if you have visitors, that's great, and we're going to open that back up on the 7th. But now is not the time to take grandma and grandpa and the whole family and go, do a shelf check at the BX, or all go to the commissary together. So that's possible that it could happen, but I'm appealing to people to not do that. That you shouldn't be doing that anyway right now. You should only be taking family members when you have no other choice, i.e. I got to take my kids with me. So, but we're trying to limit that foot traffic by design. And then if we do have some people that do that, I'm not saying you can't, but you're going to be wearing a mask. So that we help mitigate the risk by doing that as well. So if I see that becoming a problem, we may have to look at some policies and restrictions. But that becomes an enormous burden. I mean, if you've all been to the commissary and you've seen, I mean, they've got a person who sits there all day watching numbers and making sure that people have masks and checking IDs. I can't put a person like that at every facility on base. So
that was, the only exemptions I was thinking of was still the commissary has a requirement that you have to be an ID card holder. And then places like our club that we are open, there's still a limit on how many people can be in there at a time, because we want to make sure that we don't overdo what public health is requiring of us.
Yeah, so everything that opened back up with consultation with public health. So they have a set of guidelines and rules that they've been given by public health in order for them to operate on base. Right now, I'm comfortable with where we're at, and we're gonna keep it where it's at, and eventually we'll start to open back up, but it's gonna take longer than anticipated because we're seeing cases come back. So, okay.
As of right now, that is all the questions.
Oh, okay. We'll see if any more pop up. I think if there's anything else we need to go over.
I just think, as we've been saying, this is going to be we hope that we come up with a vaccine and that we're able to get through this as fast as possible. But the reality is we're going to be going through these up and downs up to the next 18 months. And so we just have to be patient with each other and always be looking to what's the most current guidance, what can I do, what can I do.
Yeah, that brings up a good point. So one of the things I forget which post it was, I think last week that I put up, this whole idea of can I do something versus should I do something, and that's where we go back to personal responsibility. Yeah, can I go on leave to Orlando, Florida? Based on the policy, you could. Should I go there if it's a hotbed for COVID right now? That's another question. Disney's not open anyway, so so those can and should questions are ones that we need to ask ourselves as we go forward. And it applies down to the little thing, like we just talked about visitors. So can I take grandma and grandpa to the BX? Well, I can. Should I? Probably not. Why risk the exposure for them and the exposure of other people on the base? So get in, get what you need, and then head out. And then when I put the note out yesterday about masks, we can control. And we're not going to get it right 100%, but we can control our base facilities. I can't control anything outside the gate. So the state of Missouri, outside of the fact that Johnson County put a mask policy in place, the state of Missouri on 30 June basically lifted all restrictions on businesses. So you're going to be able to go back downtown, and things are going to get more and more normalized as we go forward. And one of the things I talked about yesterday is if you walk into a place and any typical restaurant, and no one's, all the tables are pushed back together, no one's wearing a mask, it's full of people, that's one of those ones where it's probably better for you to turn around and walk out and go someplace else, because I can't dictate what's happening down there. I can only dictate what's happening here on base, and I need you to make good choices.
And I'll tell you, I think as you get away, for me, having been in Missouri and nowhere outside of an hour for almost 6 months, and then having to go on emergency leave. And one of the locations I had to go to, it was obvious that nobody was following the rules, and it made our travel much more difficult because we were following the rules, and so we couldn't go out to eat with certain family members. We couldn't do things that other family members were doing just because of the fact that the places weren't following the rules. And we wanted to be as healthy as possible to be able to come back to work and not expose Colonel Schreiner or not expose the people I work with. So that's where it can be very challenging.
All right, so one question was about the Johnson County guidance versus our guidance. Is ours going to at all mirror theirs in regards to the fine that's in place, I guess, with Johnson County, or is ours completely separate for the base?
So the base, we're not part of Johnson County, the base resides in Johnson County, but this is federal property, federal jurisdiction on the base. So no, that would not apply. Johnson County, whatever fine structure they have, would not apply to anybody on base. And no, I'm not going to have people roaming around writing tickets for mask wear on base. I get back to, we win this by working together, and if we create that kind of hostile adversarial environment, I mean, we need to put all our feelings and politics aside on this. So it's almost become tribal in this country between the masks and the no masks. And you're all part of Team Whiteman. And Team Whiteman right now, because we're in the midst of seeing a rise in COVID again, we need to put our masks on. That's all I'm asking. Okay?
And then one specific question about the BX. Is that all going to require mask wearing?
Yes. Any public facility on base is going to fall under that policy. So if you can walk into it, it's going to require a mask. So. Questions are kind of slow today. So.
It's good.
Yeah.
I think. It means your message is getting out.
Well, we'll hang on for a few more minutes here and see if anybody else chimes in with some questions. For those of you that are maybe re-watching this later on this evening, you can always put questions up in the post, and the team will get to those. And if it's something that I can answer, I'll do. I might chime in myself on the Facebook feed to try to answer some of that. No weird stuff today.
About chickens?
Chickens roaming around the base.
Nothing today.
Nothing today.
I think people are ready to go on this 4-day weekend.
Yeah, I think everybody wants to just get out of here. Hey, myself included. I need a break.
And then back to the school, actually, is there any word on when that may reopen for the schools on base?
So they, right now, the last I saw from NOB, I think the first day of school is the 24th of August. And they'll, when the NOB opens back up for business, the elementary school here will open up as well.
They're already starting the summer sports programs,
yes.
And they've got some rules in place to ensure that they're doing as much as they can to protect our kids who are already starting sports programs.
So if you just moved to the base, if you've got a really big lineman,
Yes.
non-football team could use some linemen right now. All right, looks like we're slowing down on any questions.
No more questions.
Okay.
You got some comments you need me to address?
No, there are questions about wearing a mask outside, but that does go back to the policy that was shared. But if you do want to,
an initial draft of the policy, we did talk about potentially doing masks outside in large gatherings. I'm just not ready to go there yet. I think we're in the middle of summer in Missouri, and the idea that we're going to all roam around with masks on outside, I think it's challenging. a lot of the time when you're outside, you're probably participating in that cardiovascular type activity anyway, if you're working out outside and running or doing any kind of sports. So we wouldn't want to wear the mask for that anyway. So we're gonna by design not do a lot of big gatherings. And when we do, like tonight, we're gonna put mitigations in place in order to ensure that people are afforded the opportunity to spread out. And I need people to do that. So, but you won't see too many. We canceled the kickback day, not because we didn't want to have it, because we had a lot of really good stuff on the slate for that. But there was just no way that we could do the classes the way we wanted to do them and keep people apart enough. So we're going to try to not bring large groups together, and by doing that will, in my mind, people are going to kind of be naturally spaced outside and no mask because of that.
And I think it goes back to the same thing we've said over and over. Just because you can do something, should you? Or just because you don't have to, doesn't mean you shouldn't. And so when you think about environments where you're outside, you know, if you're outside exercising and you're by yourself, no, probably don't need a mask. If you're at a fireworks event and you're sitting in a circle with just your family, no, probably don't need a mask. But if you decide that you're going to walk around and say hi to other people and get near them, then it probably makes sense to put your mask on. And so we just want you to think through, you know, if there was a building on fire, unless you're a fireman, you're probably going to get as far away from it as possible and not take the risk. And we're asking for the same thing with masks. You know, just think through what you're doing and what makes it the best sense to keep you safe and keep somebody else safe.
Yeah, I mean, I'm not a doctor, but as far as what we have seen and what you can read about in the media, the cases where lots of people get infected quickly, it's usually an indoor event. Nobody was wearing a mask. They were in there for an extended period of time together, and then everybody ends up sick. So
even families.
So outside, I think as long as we're smart about how we do the events, one, we're probably not near each other for as long. That's why we didn't do kickback, because that would be a lot of people in one place for an extended period of time. But even the fireworks tonight, you know, it's probably a half-hour show and then everybody goes home. So, okay.
And then you said one more as of now, and that's for when visitors are going to be coming in, are they going to be required to wear a mask, or is following generally the same policy?
So if you bring visitors on base, they are on the installation and they are required to follow those mask guidelines when they're on the installation. So, I mean, I don't know that that's going to be a huge problem. I mean, the reality is, where are you going to take your visitor on base? Maybe the food court. Can't sit down in there anyway. So there's not a lot of facilities on base where base visitors are necessarily going to be using public facilities. Okay.
As of now, no more comments, no more questions.
Okay. Well, looks like we put about an hour in on this. So if you have more questions, please put them on the feed, and we'll do our best to get you good answers. We got a lot in front of us. This is far from over, and I would ask that, you know, whatever you think about it, you know, whether you're fatigued with talking about COVID, you don't believe in COVID, you're scared to death of COVID, I would say let's just all be measured, and let's think about each other here, and think about the bigger team and what we're trying to do here. And we are providing for the national defense of this great nation, and think about that as you vacation this weekend and take in the 4th of July. At the end of this weekend, we need to come back. We need to be as healthy as we can be, and we need to be ready to get the mission done. And that takes us making good personal choices. And if we do that, we're going to get through this, and we're going to be just fine. Okay? All right, so unless there's any parting questions, we'll wrap it up.
No more.
That's it. All right. Thank you, Team Whiteman. Enjoy your holiday weekend. Look forward to seeing you out for the fireworks tonight. Socially distance. Bring a mask if you need to get close to anybody. And we'll have a good time and have a good weekend. And we're out. Thank you.